Welcome to Board Certified, expert interview episodes about medical licensing exams and healthcare careers. I'm Tyler, the founder of Achievable, and we offer affordable adaptive online prep courses for the USMLE Step 1, MCAT, PTCE, NPTE, and others. Each course contains everything you need to succeed, including comprehensive study guides, video lessons, thousands of practice questions powered by our memory enhancing space repetition algorithm, and full length practice exams. You can try any Achievable course for free by going to achievable.me, and if you like it, use the code podcast for 10% off. Now, let's get started. Today, we've got Jessica Freedman from MedEdits, and Jessica, I'd love if you could introduce yourself.
Sure. Hi, everybody. And Tyler, thank you so much for having me today. It's a pleasure to be here. As you launch this new podcast, which I think is super exciting, my name is Dr. Jessica Freedman. I am the chair and founder of MedEdits Medical Admissions. I am also a physician and a former faculty member at the Icahn School of Medicine at Mount Sinai, where I worked in both residency leadership. I was involved in the medical school in terms of teaching medical students and on the medical school admissions committee. I founded MedEdits in 2008, so a little bit of a while ago, and we have been guiding students ever since, and MedEdits has grown, and I have a phenomenal faculty. I have also written several books about the medical school admissions process that you can find on Amazon, and I am so happy to be here today.
Yeah, thanks for joining us. We're really excited too. And really, the goal of today's episode, I think, is to do kind of a walkthrough of what a 4 or 5 year pre med plan looks like. And I guess when you're having these conversations with your clients, how do you start this? Do you just say, okay, freshman year, do this, or do you kind of try and give them the big picture first?
Yeah, that's a great question. It largely depends on the student, and it also largely depends on when they are contacting us. For those students who start college knowing that they want to be pre-med, the the approach that we generally take is we say, look, it is everyone's so eager to just dive right into everything the second they get to college. But what we find is that there's a huge transition from high school to college. Your parents aren't around, things aren't as structured. You don't have your friends, you don't know how you're going to be spending your social time. So the general advice that we give freshmen is take it easy. Start with your basic prerequisites. We generally will recommend that students start with bio and general chemistry if they can handle that, or if they want to retake calculus, assuming that they have AP calculus credit, we might recommend that they choose either biology or chemistry, and then they take calculus alongside one of those two sciences. However, there are some students who are going to say, look, my high school was really easy. I didn't have to work that hard. I'm going to this really rigorous college. I'm kind of afraid that I'm not going to be able to keep up. I want to sort of take a very slow start. And in that case, what we might recommend is look, then just start with one science, start with biology or start with chemistry. Choose the one that is your strongest subject as you kind of get into the groove, as you start to figure out how you're going to study, how you're going to balance your academics, your extracurriculars, and your social life, as you find your friends, as you maybe get over any homesickness. And so for those students, we might advise them to start a little bit more gently. The thing with med school, the luxury, right, of applying to medical school is that there's no firm timeline. So
Mhm.
we're always advising students, regardless of when they're starting with us and regardless of when they're deciding to be pre-meds, we always tell them you've got to be open to flexibility because things happen and you might not do as well in a course. You might need more time to demonstrate your academic excellence. You might need more time to prepare for the MCAT. So we always try to encourage our students to sort of build in that flexibility as they're making their timeline. As far as activities to get involved with when students start college, again, we tell them start gently. If you have an on campus ambulance service or EMT squad, those typically are very, very competitive clubs to become a part of. If you're interested in that, apply, show your interest. You might not get in the first time you apply. Sometimes, these very competitive clubs in college take a couple years to become members of. So you don't always get in the first time you try. Join some pre-med clubs to really find out what opportunities exist at your undergraduate college, to talk to other pre-meds, find out what worked for them. But don't really start thinking about diving in deeply to those pre-med extracurricular and scholarly experiences until you're at least a second semester freshman.
Yeah, and I mean, it sounds like really you're not trying to like overwhelm people, but also that you're trying to make sure that they stick on the path, right? I feel like if you try taking four things in the first year, you might just end up quitting because you're overwhelmed.
Yes, absolutely. And it can be overwhelming so quickly. And establishing that strong foundation is so important as students are moving forward. So, let's say students start college, and this is very, very common where we work with students who are starting to work with us, junior, senior years, and they're like, look, freshman year was so hard. I got, and I hate saying a B is not a good grade, but we are seeing grade inflation at a lot of colleges now, and they're like, look, I got a B or I got a C plus, and I'm, my freshman year has doomed me. But a very common pattern that we see is that students don't perform as well freshman year for all the reasons I've mentioned. And then they tend to trend upward in their grades as they're getting, into junior and senior year, when most of what they are doing is going to be focused on their major. We generally see a natural kind of upward progression and upward trend. And those trends are really important to medical school admissions committees. But yeah, we really
Yeah.
don't want students to overwhelm themselves. Absolutely.
Yeah, that's really helpful. So I'd love to break down kind of each piece of like the things you just talked about, starting with course
Mhm.
planning. So let's say that you kind of have a typical start and maybe freshman year you're taking bio and chem. What
Uh-huh.
else are you doing? And kind of with like sophomore year, junior year, senior year, what are the different courses that you should be expecting to take?
Sure. So, in terms of prerequisites, and we do recommend that all students take these prerequisites. We don't want them placing out of courses using AP credits. It is common that students use their AP credits to place out of courses, that when they're then applying to medical school, they find out there are a number of medical schools that require they have those courses and they can't use their AP credits to place out of those courses. So, and this is why we like to take a very traditional approach to prerequisites, because the confusing thing about this and the aggravating thing is that every medical school has its own pre-med requirements, which is why we like to
Yeah.
stick always to the basics and stick to those traditional prerequisites. So those are, and let me just list them, and then we can kind of go over the different timelines that we recommend, generally speaking. So general chemistry, 2 semesters or a full year sequence, if your school is on quarters. General biology, okay, and again, for every college, these courses are going to be different. See, whenever something else we like our students to do when they get to college or when they decide they're going to be pre-med, go to your pre-med office, find out what the prerequisites are at your undergraduate college, okay? Then we're talking about a year of organic chemistry, a full year with lab, a full year of physics with lab, biochemistry, which is usually just 1 semester. Then medical schools like to see math. And so we recommend a year of math. Many students are going to place out of calculus using AP credit. For the overwhelming majority of medical schools, that is going to be okay. But there are going to be a few medical schools that recommend college level calculus. So we know of some undergraduate colleges, for example, that tell their pre-meds you have to take calculus as an undergraduate, but not all undergraduate colleges are going to recommend that. So again, this is why it's important to go to your pre-med office and find out what is recommended for pre-meds at your school, because it varies from school to school. All right. You also need to have, we recommend at least a year of writing, because writing, not only because med schools require it, a lot of them, again, not all of them, but because writing is so important to be successful in the medical school admissions process. We see that our applicants who are strong writers and can create great documents do better in the process. So this is why we don't like our pre-meds who are STEM heavy kids, right? They love STEM and they want to shy away from all the humanities
Mm-hmm.
and all the writing, but yet it's our students who are really great writers who have that humanities background as well, who tend to create these really beautiful and moving documents. So for our traditional students, okay, meaning, and I would like to say, in my day, traditional meant you applied at the end of your junior year, you applied during your senior year, and you went straight from college to med school. That is now not the traditional focus. So I don't know why we don't call that the traditional applicant, because now that's honestly the non-traditional applicant. But the students who want to go straight through, who want to go straight from undergrad to college, they need to be very streamlined in how they're approaching their prerequisites. So they want to be taking definitely a full year of general chemistry, a full year of biology their first year. Maybe they're also taking math at that point. They can kind of fit math in wherever they want to, even in their senior year, because it is not necessary for the MCAT. Second year, they want to be taking, their sophomore year, they want to be taking physics, they want to be taking organic chemistry, and they want to be taking biochemistry before they take the MCAT. So this is also why some students might be sneaking in summer classes between their freshman and sophomore year to satisfy some of those requirements, depending on when they're taking the MCAT. So for traditional applicants who are applying at the end of junior year, a lot of those students want to be taking the MCAT or prefer to take the MCAT at the beginning of junior year. We tend to find that those students are going to do better if they're taking the MCAT in the spring of their junior year. They're taking biochemistry in the fall of their junior year. They're taking the MCAT in the spring of their junior year. They're submitting their application at the end of their junior year, right? So you can see how quickly that all piles up, right? And we haven't
Mm-hmm.
even gotten
Right.
to activities that they need to
Mm-hmm.
be involved with.
Well, and I also just, I mean, it's crazy to me that in order to become a doctor, you need to also take a year of physics and a year of writing and a year of calculus. All three things I would not
Yeah.
really assume are related to being a doctor necessarily. I mean, writing kind of makes sense, but like the other two, I don't know. I mean, I
Yeah,
know the reason why, right? Like yes, like the physics of how like the body, like physics impacts how the body works and fluid dynamics in particular,
yeah,
but it's a lot. You're basically taking like all the hardest college things at the same time.
it is a
Mm-hmm.
lot. And a lot of those weeder classes are just that. They're weeder classes, they are difficult. The name is appropriate. They're looking to weed out those students who can't handle that rigor. And it's interesting. We have a private Facebook group, that anybody can join. But one of the parents recently was commenting, why do our kids have to jump through so many hoops? Why are there so many requirements for them? They do so much. And my response was, yeah, it's a lot, but being a practicing physician is a lot. You have things coming at you all the time. You're juggling so much at any given moment that in many ways this is a way to kind of figure out who's going to be able to not only get through medical school but who's going to be able to practice medicine,
Mm.
because it's hard
Yeah.
Yeah.
and it requires so many different skill sets.
Yeah, and the other thing too is you're not actually picking your specialty until after you're already in your medical program for the most part, and so it's like you have to prepare for everything. But then chances are, if you're, you know, a surgeon, it's going to be a very different skill set than if you're a radiologist, and so it's like you have to
Completely,
know how all these things work.
completely.
I am curious though. So I mean, you talked about like the MCAT timing if you're basically trying to go straight from college into your medical school. I feel like that's less common now, and that a lot of people do a gap year or two. And I mean, I'd love to talk about that. I think we get to that in a second. But if you're doing a gap year or two, how does that change your course planning and your MCAT planning?
Sure. It makes things so much more, not much more, it makes it more relaxed. It makes it, you're able to enjoy yourself a little bit more. You don't have to pack in as much. So there are going to be a lot of different timelines that students can take. if they want to take a gap year. And yes, you are correct. At this point, only 25% of students are going straight through. So the majority are taking at least a single gap year. So this offers a tremendous amount of flexibility. And again, it depends on when you want to apply. So I would say that most students are taking a single gap year. So the majority of those students, what they are, most of them are doing is they are typically doing either one or two sciences their freshman year. They're typically doing two sciences. So like let's say they choose biology. They did well as an AP bio, so they're like, I want to start with biology. I know that's going to be okay because it's my subject. Okay. So let's say they take biology, they take calculus as well to satisfy that math requirement. Some students will do statistics if they've placed out of calculus. Then second year, let's say they're doing general chemistry and they're doing physics. Okay. Then maybe their third year, they're doing organic chemistry. And then maybe they're also doing biochemistry at that point if organic is not a prerequisite. Or they're doing chemistry their first year, bio and organic their second year, physics and biochemistry their third year. Then they're studying for the MCAT. This is a very typical timeline. Of course, there are many variations, but then they're typically studying for their MCAT this summer after junior year. They're taking their MCAT in the fall of their senior year, and then they're applying the end of their senior year.
Yeah, that makes sense. I mean, I think that just generally it makes it a lot less stressful to have that kind of
Yes.
thing. And I guess maybe that is probably a nice time to segue into. So, do you do gap year or not? I mean, you mentioned 25% of people don't. That means 75% of people do.
Mm-hmm.
I don't know the exact numbers, but I would guess that probably if you're breaking the 100% out, 25% do zero. I would probably say 50% or more do one, and then the last like 25% do two or more. It might even be a greater majority of people that do one gap year. But basically, yeah, it would be curious what you think about the numbers I just shared, and those are ones I pulled straight out of the air. So curious if you have
Yes.
real ones. And then I also would love to talk about like why there's a gap year now and
Yeah.
what you feel like are kind of benefits of it and the risks of it.
Yeah, sure. I would have to look up the data, first of all, to see.
Mhm.
That we get this data from something called the Medical Student Matriculant Survey, and that, they will survey medical school matriculants every year to get this information. Um,
Mhm.
I would say it's probably pretty close to what you've outlined, but I would have to look it up. We could always follow up about that at another time. In terms of whether or not students take a gap year, it largely depends on their experience profile. So sometimes it depends on academics as well. So sometimes we'll have students who, let's say, from an experience standpoint, from a course load standpoint, they're all ready to apply at the end of junior year. But when we're looking at their grades, they may not have the GPA, they may not have the grade trend that we like to see to guarantee their success. And so we may then recommend, look, you need 2 years of upper class grades behind you in order to be a competitive applicant. So we're oftentimes doing this or I guess all the time we're doing this based on our assessment of a student's competitiveness. And we can
Mhm.
be assessing them in terms of their competitiveness based on their academic profile, and then their competitiveness based on their extracurricularly and scholarly profile. And of course, a lot of this also depends on what their goals are. A lot of what we're focusing on, I feel like, even though we haven't said it, is allopathic or MD granting medical schools. But if a student is aiming to go to osteopathic medical schools, that profile is going to be different than what a student needs to have to be competitive for allopathic med schools. So when we're advising a gap year, and again, students don't have to take gap years. And the students whom we worked with this year who did not take gap years did unbelievably well, because these tend to be the students who are so driven, so motivated, they can balance a ton, and this is what they want to do and they get it done, right? So like our traditional students, our non-gap year students do unbelievably well. But when we're making that suggestion to take a gap year, we're really looking at those two things. We're looking at the academic profile, we're looking at the extracurricular profile. There's very little risk in taking a gap year. There's actually no risk. A gap year can only improve your candidacy, right? Whether you are doing academic enhancement to boost your GPA, whether you are engaging in meaningful activities that are related to your interest that you've already established, or you are adding to experiences that maybe you need to bolster a bit, or maybe experiences that you don't have. A gap year can only help you, gives you more to talk
Mhm.
about on interviews. You're more mature. We definitely see some students who just we don't think are necessarily mature enough. They just aren't sophisticated, as sophisticated as maybe they would be with another year. I mean, we see a lot of growth in that gap year. So, those are sort of some of the major things that we really think about.
Yeah, that's great. And I think that also then kind of to go backwards a little bit, I'd love to also talk about like activities. You mentioned the
Mm-hmm.
EMT club, right, in
Mm-hmm.
your school, and that it might be competitive to get into. And I'd love to talk about just like activities in school and then like good gap year activities as well. I mean,
Yeah,
or jobs
sure.
in the case of the gap year.
Yeah, sure. Okay, so activities kind of fall into several major buckets. All right. There are what I like to call patient facing experiences. There's been a lot of emphasis lately that students have to have clinical work experience. They have to have clinical employment where they either work as a medical assistant or they work as an EMT or they work as a scribe. We find that students don't have to actually have paid work experience. It's great if they have it, but they don't have to have it. But they have to have something where they are forward facing with patients. They are working directly with patients. So they understand the patient experience. They understand the healthcare environment. They understand, operationally what's going on in whatever area they're working in. They understand teamwork and collaboration and all of these various things that sort of encompass the practice of medicine. So, patient facing work is an absolute must. That can come in the form of paid work, that can come in the form of community service. There are a lot of different forms. That can come in the form of research, right? Clinical research. So, like, there are a lot of different ways that you can get that patient facing experience. For students, especially who are aiming for top schools, research is essential. If you're aiming for osteopathic med schools, not as important, but if you want to be competitive, especially for top tier allopathic MD granting medical schools, you have to have research. Okay.
Mhm.
Something else that we consider a must is some level of community service or civic engagement, volunteer work, however you want to think of this. As physicians, we are engaged in our communities. We are always advocating for our patients. So that is really important. I can tell you in the emergency department, as an emergency physician, I advocated for my patients every single day. So having those skills, being able to demonstrate that you understand the importance of that and that you can advocate for others and you can understand people from different backgrounds is vitally, vitally important, not just in terms of, getting into med school, but in terms of actual practice, because that's what we do. So some type of sort of community involvement is absolutely important. And then there are other things like, teaching. As physicians, we're always teaching. We're teaching our patients. If you don't even have to be in academic medicine, if you end up in academic medicine, obviously you're teaching your residents, you're teaching your students, but we're always teaching our patients. And we're teaching people who have very different backgrounds, have to be taught and communicated to in different ways. So that can be very important as well. I mean, the list goes on, really. I'd say those are the major buckets.
Yeah, no, I mean, I think those are good, good major buckets, right? And I think at the end of the day, you got to be able to do your own research and figure out like within these large buckets kind of what are the specific things you want to do and what's going to be most relevant to your program. If you can't do that, then there's a lot of other things in this process that are going to be hard for you.
Yeah, yeah. And and you allude to something, you don't want to take a checkbox approach to this. You want to figure out what you are interested in. So, and this is something whenever people say, well, how many, I get, every single live Q&A I do, how many hours do we need of this and this and this? And it's like, The answer is different for every single student. It depends on where your interests are. It depends on where your, basic level expertise is, so for one student, they might be successful with 2,000 hours of research, but another student might have 300 hours of research, but might really excel in whatever their community service involvement is. And then of course, we look at the timeline. A student who is a gap year student or has had, let's say, 2 gap years is going to have way more hours of experience than a student who's applying at the end of their junior year.
Right. Well, and it's also like you said, the maturity factor is like just going out and getting out into the real world where you have a job and a paycheck and a budget like can make a big difference.
Yeah.
Great. So I'd love to like a little bit now shift gears just to talk through the application process. This is
Mm-hmm.
an important part of being a successful pre-med. And so I'd like to start with like talking about the timeline. So I mean
Yeah.
I know that you already kind of alluded to it, but like just for the sake of
Yep.
conciseness and also like being focused on the timeline itself, can you just run us through a quick
Yeah.
timeline for, going straight through and then like with a 1 year gap year? I think that would probably be
Sure. No, I'd
good.
love
Yeah.
to. I mean, the timeline is the same no
Mhm.
matter whether you're taking a gap year or not. So the official timeline starts in early May of whatever year you decide to apply,
Mhm.
right? That's the official timeline. However, in, let's say, February, March is when we start strategizing. You want to be thinking about who's writing your letters of recommendation. You want to be thinking about how am I going to start, composing the major components of my application, which are writing about your activities, so all of your experiences, and then your personal statement. So that pre-work, in the ideal world, I always present everything in terms of the ideal world. So in my ideal world, I would love if we could get everyone starting to work on their documents and think about their documents and start requesting their letters of recommendation in February or March. Okay. Then application systems open in early May. That means
Mhm.
AMCAS, which is the allopathic application system, TMDSAS, which is the Texas application system, and AACOMAS, which is the osteopathic application system. Those all open in early May. So you open up all those applications, you start filling out your biographic data, you have copies of your transcripts next to you so that you can enter all of your coursework exactly as it appears on your transcripts. You request your transcripts to be sent to AMCAS. TMDSAS doesn't require them until you're accepted. AACOMAS, those go straight to the medical schools. I'm nearly positive. I need to double check that, but you want to request your transcripts. That's a key because the AMCAS has to have your transcripts in order to verify your application. So you
Mhm.
do all that in early May. You finish up the major components of your application. You request your letters of recommendation be sent in at that point. And then for TMDSAS and AACOMAS, you can submit your application, hit the submit button in the middle of May. For AMCAS, you're hitting the submit button at the end of May. Okay. Again, ideal timeline. That's the earliest that this can happen. We have students who are still submitting now. It is not too late. It is fine. Okay. But that's my ideal timeline. At the end of June, AMCAS will send verified applications to medical schools. At that point, medical schools are going to send out secondary applications. It's the equivalent of like supplemental essays
Mhm.
for college. And at that point, you start working on your secondary essays. Some students, if they have time and they're not compromising anything else, they will pre write secondary essays based on the previous year's prompts. Prompts do change from year to year sometimes, but not often.
Right.
And
Well, and at the
then,
minimum, it'll give you a head start potentially.
exactly, they'll give you a head start. It gets you thinking, and it's a lot of writing. There's a lot of overlap in terms of the themes, but it's a lot of writing, and it can be really overwhelming for students. And then interviews will start to be extended. I mean, last year we had our first interview extended in like the first week of July. The majority of interviews aren't going to start going out until like, August, September.
Yeah. So then there's three application systems. I mean, one of them's just for Texas, which is very Texas of them. But I'm curious, like, do you recommend that people really pick one? I mean, the Texas one I understand is like a little bit of an outsider, but between those two, those are kind of two different career paths, really, right? So are people generally only applying to one system, or are they actually, is it pretty common for people to do multiple?
So you mean AACOMAS, osteopathic and allopathic?
Yeah, osteopathic and
Yeah.
allopathic, yeah.
Okay. First of all, they're not two different careers.
Okay.
And osteopathic physicians will bite your head off for saying that.
Sure.
um,
I mean,
um,
I bleed
uh,
ignorance, but yeah.
osteopathic physicians and allopathic physicians, we're all physicians. I mean, I worked in academic settings, I worked in urban settings, I've worked in community settings. In all of the settings I've ever worked, I've worked alongside osteopathic physicians. So we all practice medicine. Osteopathic physicians do incorporate manipulative therapy, but not all of them do in practice, but they learn it and they know how to incorporate that into their practice if they so choose. But whether or not a student is applying to both of those systems usually comes down to their level of competitiveness. Allopathic med schools are more competitive than osteopathic medical schools. So there are going to be some students, if we feel they are competitive enough to get into allopathic med schools, we'll say to them, you only need to apply to allopathic med schools because you're competitive enough to get into those schools. There are going to be some students who we might say to them, you're borderline competitiveness for allopathic med schools, so we want you applying to both systems. If they're applying to both systems, they can use the same personal statement. Several years ago, AACOMAS, the limit on the personal statement, the character limit was a little bit different, but they recently increased that limit to match AMCAS's limit. The majority of osteopathic med schools are going to ask why osteopathic medicine in a secondary essay that doesn't need to be addressed in the personal statement. So you can use the same personal statement. As far as the experience descriptions, they're only 100 characters shorter than the AMCAS descriptions. So you just have to trim by a tiny bit. And that's not a big deal. So, and then we have students who we say, you're not competitive for allopathic med schools. We think you should only be applying to osteopathic medical schools. So this is, an informed decision that students make depending on which system they're applying for.
Yeah, great. Yeah, and I mean, I think that it's good to know that they overlap quite a bit, right? Just
Mm.
like with what essays they're asking for and things like that. And it sounds like they kind of look at each other and like make sure there's a fair amount of overlap. But do you feel like you should be approaching the applications any differently for each type, or do you mostly just kind of do it the same way?
We do it the same way. I mean, if students are applying to osteopathic med school, we want them shadowing an osteopathic physician. So if we talk to them and we feel that they're only competitive for osteopathic schools, or we think that they're, kind of, it's a little bit of a toss up, we'll say, go shadow an osteopathic physician because those schools ideally want a letter of recommendation from an osteopathic physician as well.
Right. So, I mean, let's talk about the other parts of the application that are not
Yeah.
just the essays, right? So there's
Yeah.
letters of recommendation, there's holistic review, there's potentially like, trying to squeeze in some last minute work experience things. Starting with letters of recommendation, I mean, if you're the perfect pre-med student, how are you setting yourself up to get good
Yeah.
letters of recommendation when you need them?
Yeah. I love this topic. So, first of all, and thank you, we're going to go back a little bit. Starting freshman year, we encourage students to get into the habit of going to office hours, getting to know their professors, being comfortable with those dynamics, and that sets the stage for then establishing relationships with your professors and being in a position to get great letters. Okay. So you do that freshman year, not because you're going to get letters from freshman year professors, you're not, but we want that to become part of your routine, part of your drill, and part of your comfort zone. Okay.
Mhm.
The ideal letter complement, if we had to choose, and again, there's some variation, right? If let's say a student has a gap year, has 2 gap years, they are potentially getting additional letters of recommendation from their gap year. If somebody, let's say, has done some academic enhancement, we haven't talked about this yet, but a special master's program or a postgraduate program, maybe an MPH or something of that nature, they're potentially getting additional letters of recommendation from faculty within those postgraduate programs. But at baseline, we want them having 2 STEM letters from science professors, ideally not math, because math professors also tend to not write the best letters, just as like a very, stereotypical kind of generality. But ideally, 2 science letters, then ideally 1 non-science letter. Some medical schools are going to recommend this, just like prerequisites. There is no uniformity in what letters of recommendation medical schools want and how many. Some are going to limit the number that they want from you. So
Hmm.
we like students to have 2 science letters, 1 non-science professor letter, and then ideally, if like whatever their strength is, we want a letter in that. So let's say they have been doing research for a couple of years and they have a really good relationship with their principal investigator. That principal investigator letter is really important. So that sort of becomes our ideal complement. If a student, let's say, most of their involvement has been in community service or has been in some other realm, we can get an additional letter of recommendation from someone with a leadership role within whatever they've been doing. But we might also have them submit for professor letters, right? There recently was a medical school, this is new, who asked for a letter of recommendation from somebody in healthcare. Could be a physician, could be an NP, could be a PA. That's a new requirement, right? So like, and for that one specific school, first time I've seen that. So, this could come from someone a student has shadowed. In the past, we've seen shadowing letters. Those are typically have been considered more sort of character reference letters. But with this, it's going to be interesting to see if this trend is going to now be adopted by other medical schools. I mean, something we're always doing from year to year, and we have this luxury because we work with a number of students every year, is we're really watching these trends and how things are changing and evolving.
Right.
And they do change and evolve.
Yeah. So you have to like set yourself up to be able to get all kinds of different types of recommendation letters just in case, right?
Yep.
Yeah.
Yep. Like I talked to a student yesterday who is a rising junior. Okay. And this student is taking a required writing class. I think it was poetry. But as a science major, and I said, look, I was like, you want to make sure that this professor is it. You want to go to office hours. You want that professor to know you. You want to, at the end of that class, ask for a letter of recommendation, but ideally those letters should be dated the year you apply. So you want to keep in touch with that professor over the course of the next year and a half, because the student's taking a gap year, so that then when you're ready to apply, when it's 2027, when you're
Mhm.
actually applying, that you can then go back to that professor and ask for a letter of recommendation. And they're not saying to you, I have no idea, who is this student, coming out of the woodwork? I have no idea who this is.
Right. Yeah, I think that makes a ton of sense. I also think it's just like, these poor professors are like, oh, this person's such a good student. They must really like want to learn. And it's like, nope, they want a letter. But I mean, I'm
Yeah.
sure that everyone's doing that.
Listen,
Um,
everyone knows. I mean,
Yeah.
they're ambitious students. Like, it's not just like a means to an end. I mean, one thing I can say for like the vast majority of students whom we work with is like, they really want this. Like, it's all so sincere,
yeah,
you know?
for sure. Well, and then you mentioned something when we were talking about letters that I thought was interesting, which you were talking about basically like alternative postgraduate programs.
Mhm.
And I'd love to dig into that a little bit because I feel like it also correlates to kind of another thing I had questions about, which is like, what do you do if your grades or MCAT score is not quite where you want it to be, and kind of how can
Mhm.
you fix that situation? And maybe the post grad programs are a part of it. So, however you want to kind of tackle those two topics.
Yeah, sure. So, sometimes we'll work with students and we just don't think they're competitive. When we're looking at their competitiveness, we're looking at a whole host of factors. And to need to do a postgraduate program for grade enhancement, you definitely aren't going to have the GPA that we want for whatever your goals are. Okay, so that's sort of those are those clarifying statements. There's
Mhm.
something called special master's programs that are specifically designed for students who need to enhance their grades for medical school. Georgetown is the oldest one, a very rigorous one, very competitive. Students do well. And for most of these programs, for a lot of them, you're taking classes alongside medical students. Some of them will have their own curriculums. And this is a way to prove yourself in a scientifically based, rigorous curriculum. So that's number
Mhm.
one. Students will engage in postgraduate programs where they don't necessarily need grade enhancement, but they're doing something to set themselves apart. So let's say someone has an interest in public health. They might get a 1 year MPH, a 2 year MPH, and that's a way for them to explore an interest that they have and while setting themselves apart in the application process. We have students who've done masters in ethics, masters in global health. So there are a whole bunch of, master's programs that you can do to set yourself apart in the application process. So not even necessarily for grade enhancement. Then we have students who might just enroll in some additional either graduate or undergraduate level classes
Mhm.
to continue that GPA bump that hopefully they've demonstrated over at least half of their junior year and their full senior year. We like to see 2 years of strong academic performance, and that has to include STEM classes, obviously, in order to, really prove that you're a strong applicant for medical school.
Great. Yeah, and then what about the MCAT? Let's say your MCAT comes
Mm,
in and it's not really what you want, right?
yeah.
I mean, when are you usually, like, I apologize if you already covered this as part of an earlier
Yeah.
segment, but like, when are you usually taking the MCAT, and then kind of how much opportunity does that give you to fix your score that then and there? Or what if it's at the point where it's
Mm.
like, do I delay applications a year? Like, what do I do then?
Such a good question. And in fact, okay, this is so timely at the moment, right? Because MCAT scores just came out. We have students who submitted applications, the end of May with plans of applying this year. And we have students who aren't happy with their MCAT scores. Let's say they got a 509 or a 510 and they were scoring, 515 on practice tests. So now we're in this position where it's like, okay, you want to retake it. We get that because now with a 509 MCAT, you're a borderline competitive applicant for allopathic med school, and that's your goal. So now the question becomes when to retake. We have students who want to just turn right around and retake that test in July. All right. For the vast majority of students, this is a terrible idea because, first of all, you take an MCAT in July, that MCAT score isn't back until August. Med schools aren't going to even start reviewing your application until that next MCAT is back. So that makes you a relatively later applicant, number one. Number two, usually when students just quick turnaround and retake a test, they don't bump their score significantly unless there was a very clearly identifiable reason why they underperformed on that initial test. So it requires really digging in and unpacking why didn't you do as well as you wanted to do. And that requires some intensive work. Generally speaking, we're recommending a minimum of 3 months to really figure that out. Okay, so that's the scenario. If you're taking the MCAT, let's say in May, you're getting the MCAT back in June, and you're applying and it isn't what you want it to be. All right.
Mhm.
Another reason why that sort of becomes a little tricky. If you're taking the MCAT in the fall, and let's say you're applying the next year, so you're taking the MCAT, let's say in September, but you're not applying until the next May, that's going to give you a lot more flexibility, a lot more wiggle room. So you get it back, you're like, okay, didn't get what I wanted to get. What do I need to do to improve my score? And that gives
Mhm.
you a significant amount of time then to really figure out what you need to do to improve and to retake.
Right. Well, it sounds like that's a much better way to go about it, realistically.
Mm-hmm.
Yeah, which means you're doing MCAT prep like early, like very early.
Well, it depends. Like, so let's say someone knows they're taking a gap year. Let's say someone knows they're taking 2 gap years. So some, for example, clinical research positions want you to commit for 2 years. So let's say we know someone's taking 2 gap years. They take their exam in May after their senior year. They get the score back in June. They're like, I didn't get what I wanted, or they take the test in September, they didn't get what they wanted. They still have a whole other year to sort of figure that out. So it isn't as
Yeah.
much crunch time.
Yeah, that makes sense. And
We're always
then,
marching these things out with our students, and we always sort of we're trying to come up with plans. You never want to say to a student, okay, what if you don't get what you want? Because we don't want them thinking that way, even though we're potentially thinking that way. It's always a risk you take when you're taking an MCAT close to your when you're submitting your application. And that's a
yeah,
known risk.
Mm-hmm.
right. Yeah. Well, so then I think you've done a great job covering almost everything here. I think maybe just like the last two things I wanted to ask about, and we don't need to get too far in the weeds on these because these are
Mm-hmm.
kind of like getting deeper into the application stuff, but
Yeah.
like the holistic reviews and the interviews, right? How can you be the shining emblem of the perfect pre-med student at these two stages?
Yeah. Great question. Holistic review is real. All right. For example, we had a student this year, amazing extracurricular scholarly profile, amazing GPA, on a relatively low MCAT average of like 511, ended up at a top 10 school. All right. That is a perfect shining example of holistic review. This is a student who had an MCAT where most people would have said there is no way you're ever getting into that medical school with that MCAT, but they had such interesting experiences that they wrote about so beautifully. Okay. Outstanding letters of recommendation, great grades, amazing interview performance or interview experience. And that applicant was looked at holistically. Okay.
Mm-hmm.
And that's how they were able to achieve that. So, holistic review, essentially, I like students to think of it, it's always going to benefit you because if you have a strength in one area and a weakness in another area, they're going to be looking at that holistically. I would say the one time when this doesn't work is when you don't have the experience profile. You have to have a strong experience profile in order to get into medical school. You can have a slightly lower average MCAT, you can have a slightly lower average GPA, but if you don't have those experiences, you're not going to be competitive.
Yeah, well,
Um,
and it's like the whole thing of holistic review is that it's taking it away from the test scores and the GPA and stuff like that, right? Which, as you said, you can only help you unless you don't have those things. So,
exactly. And the reason those experiences are important, okay, again, trying to move people away from the checklist approach is because through your experiences is how you demonstrate your qualities and characteristics. So, medical school admissions committees, the Association of American Medical Colleges has defined a whole set of core competencies that they like to see in applicants. And only a very small number of those competencies are demonstrated through academics. All of the others are going to be demonstrated through your experience profile.
yeah, and it's just like it. I think it gives you the opportunity also to like tell a better story, like you said, with that writing piece,
Yes.
and I think that's very important.
Yes.
And then yeah, the last part I had was about like the interview portion of it, right? I
Mm-hmm.
mean, just like what are the pieces of an interview that make you look like an outstanding pre-med
Yeah.
without doing
First
an
of all, it
entire
depends on the
episode on interviews, right?
yeah, of course. Oh, for every single thing we just talked about, we could just,
Do a whole
this is sort
episode,
of,
yeah.
these are nice general overviews. We could talk forever about each one of these. So for interviews, first of all, it depends on what type of interview you have. The two major types of interviews in medical school admissions are the MMI, which is the multiple mini interview developed in Canada. And essentially, it's a series of like mini interviews where you're given scenarios or where you're given behavioral questions, which, the best way to describe that is tell me about a time when. And you either talk about the scenario or you talk about, your answer to the behavioral question. And they're 8-minute interviews. And so that way you get multiple interviews. You have multiple raters who are evaluating you on your response to each of those questions. I find that most US schools do not do this in a pure way, the way Canada does it. A lot of US medical schools kind of do hybrids where some of those stations might be more typical traditional interview questions. A traditional interview is where it's a one on one interview, you and one other person, and they're asking you your standard questions. Tell me about yourself. Why medicine? Tell me about this experience. They might throw in a behavioral question. Tell me about a time when. Sometimes those questions are scripted, but more commonly, those interviews are about, what the interviewer's style is and what their approach to the interview is. And there's huge variation in that. I wrote a book about the medical school interview where I go over all of that. um, how to do well, it's about, you know understanding your experiences, understanding what's important to you, not sort of freezing up when something, you're not confident about a question, or maybe a question sort of makes you a little bit nervous. It's about reading your interviewer, understanding what their style is, kind of, responding to them in the right way. And then it's fundamentally just about authenticity and being yourself, right? I mean, interviewers are, they want to know who you are as a human being. They want to understand who you are. And nervousness is normal. You're going to be nervous at the beginning of every interview. That's okay. But I'd say the biggest thing is authenticity. That's going to make you
Yeah,
successful.
yeah, exactly. Well, and at the end of the day, you want a medical school that wants you for you and not for a
Mhm.
fake idea of you that you've created. That's
That's
going to
right.
be the best for your happiness, probably.
And this is how you made me think of something. This is, why I love the med school admissions process and how it differs so much from, let's say, the college admissions process, which gets so much press. Admissions is all about how you present on paper and what you present on paper, right? Whatever you put on paper for your medical school application, someone's going to be talking to you about that. So if there's anything that's even the least bit disingenuous or false, even if someone can't put their finger on what exactly it is that isn't hitting them right about how you're speaking about an experience, that's going to hurt you, which is why you have to be brutally honest in your medical school application. You can't embellish anything.
Hmm. Yeah, exactly. Well, great. And then is there anything that we haven't covered today that you would want to make sure you shared before we wrap up?
We covered so much. There's always more I want to cover.
Yeah. No, no problem.
Um, I'd say, and if parents are listening, be gentle with your student. Allow your student to be flexible. There's so many different ways and different timelines to get to medical school, and it's different for every single person. And you have to be able to pivot,
Hmm.
when something doesn't go exactly the way you planned, when you didn't get the experience you wanted, when you didn't get the score, the grade you wanted. So I think that that's really important.
Yeah. Great. Well, thank you so much. This has been Board Certified, hosted by Tyler and Cassandra from Achievable with Jessica Freedman from MedEdits. And Achievable has great online courses for the USMLE Step 1, MCAT, PTCE, and PTE, and others. You can try them out for free at achievable.me. And then I'd love if you could just share your website, and you mentioned a resource that you wanted to share with our audience as well.
Oh, I have so many resources. So our website is mededits.com. We also have a private Facebook group, which you can join. It's open to everybody. We have a bunch of free downloads on our website. I wrote a book about medical school admissions. It's a relatively new edition. So if you want to go onto Amazon and get that, it's going to cover a lot of what I talked about today. Yeah, we have a lot of free resources.
Yeah. Well, thank you so much.
Thank you. And thank you so much for your time.